What is vaginal dryness? What causes vaginal dryness? Vaginal dryness caused by the lack of vaginal fluids can cause discomfort in many women and problems during sexual intercourse. Understanding the cause of vaginal dryness is important for correct treatment. Vaginal dryness occurs when the fluids secreted by the glands in the vagina are not sufficient. Bartholin glands located at the entrance of the vagina and the Skene glands in the area of urine output swell with the acceleration of blood flow in the genital area during sexual arousal, allowing the secretion of vaginal fluids. A healthy vagina is always a little moist even when there is no arousal because the fluids secreted in the vagina and some of the cervix keep the inside moist. Vaginal fluids are important for maintaining the unique pH balance of the vagina and protecting it against irritation. Bartholin and Skene glands are particularly responsible for wetting during arousal. A colorless and clear liquid covers the entrance to the vagina, making it easier to penetrate something into the vagina. In some cases, the glands cannot produce enough fluid, which causes the vagina to remain dry and sexual intercourse difficult. What causes vaginal dryness? There may be several reasons why fluids that make the vagina slippery are not secreted. Inadequate stimulation. In women, sexual arousal can sometimes take longer than expected. Even if the person thinks they are ready for sex, it sometimes takes time to stimulate the nervous system and ensure proper blood flow in the genital area. It is necessary to be patient and allow enough time for foreplay before penetration. Incompatibility with the sexual partner. Communication problems directly affect this situation. When the woman does not feel safe and comfortable, the nervous system does not transmit the signals that will allow sexual arousal to occur, and vaginal wetting does not occur. Various traumas and pain during sexual intercourse also prevent women from relaxing, and this also prevents the relevant glands from working correctly. Hormonal changes. Vaginal wetness is directly related to the release of estrogen hormone, also known as the female hormone. Vaginal dryness is a very common symptom during menopause when estrogen levels change. Likewise, prolactin hormone secreted during breastfeeding can affect estrogen levels and cause dryness. Vaginal infections. Infections caused by various bacteria or fungi can also disrupt the natural fluid balance of the vagina, causing vaginal dryness. Medications used. Some medications can affect the fluid and hormone levels in the body, preventing the vagina from wetting naturally. In particular, some antihistamines, antibiotics, steroids, antidepressants and even some birth control drugs affect this condition. Some medications used by inserting them into the vagina may also cause dryness. Disruption of vaginal flora. There is a natural balance of fluid and healthy bacteria in the vagina, and this system may be disrupted by infections or medications used. At the same time, frequent washing of the vulva and inside of the vagina using various soaps, shampoos or wet wipes to clean the area causes infections and vaginal dryness by causing the natural flora in the vagina to deteriorate. Frequent use of tampons sometimes causes the absorption of all fluids in the vagina, which can lead to dryness problems. Dryness and pain in the vagina. Frequent dryness in the vagina can cause irritation in the vagina, causing a pain sensation. Likewise, having sexual intercourse without getting wet enough is usually painful, but even if there is no pain during intercourse, there is often a feeling of pain or soreness afterwards. How is the vagina structure? Vagina anatomy. The vagina is a unique organ in every aspect of a woman. The vagina has many perfections both in terms of its anatomical structure and function. This organ, which is 8 to 10 centimeters long and normally has its lower and upper walls adjacent to each other, opens, stretches and expands both laterally and longitudinally like an accordion during birth or with the entrance of the penis. During this month, the ability of the vagina to stretch, a baby with a head diameter of about 10 centimeters, a body of 50 to 52 centimeters, and an average weight of 3,500 to 4,000 grams can grow. Or, in this way, it can take a 14 to 18 centimeters penis inside during sexual intercourse. The vagina structure is in the form of the letter S in the longitudinal section and the letter H in the horizontal section. Since the vaginal walls are notched, sexual pleasure increases with each entry and exit of the penis. If the vagina were in the form of a straight canal, it would not be possible for both men and women to enjoy this much during sexual penetration. Glands outside the vagina. There are no sebaceous and sweat glands in the vagina. However, they are secretory glands located just outside the vagina, in the entrance to the vagina, that provide wetting. The most commonly known of these glands are the Bartholin glands located right and left at the bottom, right and left at the entrance, and the Skene glands that spread around the urinary hole at the top. The feature of both groups of glands is to provide the lubricity of the vaginal area, especially during sexual intercourse. Because vaginal dryness also causes problems such as pain, burning and bleeding in sexual intercourse. Even during a woman's normal walking, let alone sexual intercourse, the inner lips rub against each other, and the dryness of this area can cause irritation. What is the G-spot? Where is the G-spot? In women, Skene glands are more intense on the upper wall of the vagina, just below the urinary canal, 2 to 3 centimeters inside. It is known that this area where the Skene glands are concentrated is more sensitive than other parts of the vagina and plays a role in orgasm function. This region is known as the G-spot. Vaginal lubrication. Lubrication, in other words, vaginal lubrication, is the wetting of the vagina by irrigating it thanks to the fluids secreted from the cells forming the vaginal wall and vaginal glands. There may also be some viruses such as AIDS or hepatitis B and C in these secretions that give vaginal lubrication. For this reason, it is important to be careful during sexual intercourse and to use condoms to avoid illness. Your lubrication may sometimes be less than normal during sexual intercourse. This is usually related to the lack of pleasure or sexual reluctance in sexual intercourse. Good sexual satisfaction also reduces vaginal wetting. However, this is not a strict rule. As a matter of fact, some women may get wet a little during intercourse, even though they enjoy it, and sometimes the pleasure may be less despite the wetness. On the other hand, if vaginal irrigation is more than normal during sexual intercourse, sensitivity and pleasure may decrease in some women. Some voices can even be heard from within. In some people, these sounds coming from inside the vagina may turn into a problem by causing their concentration to deteriorate. Vaginal dryness during menopause. As a hormonal problem, vaginal wetting is often encountered with the decrease in estrogen hormone during menopause. Local, regional, effective vaginal suppositories or creams given during this period will also be a solution to the relationship problems caused by dryness in the vagina. High prolactin hormone is the cause of vaginal dryness. Prolactin, milk hormone, which increases in the postpartum and breastfeeding periods after birth, may cause dryness in the vagina by suppressing the estrogen hormone in the woman. Sometimes, apart from these periods, adenomas in the pituitary gland, benign pituitary tumors, may cause milk discharge from the breasts, galactorrhea, and decrease in vaginal watering. Vaginal infections, some medications used, hyperprolactinemia, high prolactin hormone, conditions, vaginal douching, washing inside the vagina, stress, vaginal suppositories and drugs can also complain of dryness in the vagina. Vaginal dryness is also present in the case of pain during sexual intercourse called dyspareunia. The underlying reason is that the person is not stimulated due to pain during intercourse and therefore the glands do not produce secretion. Vaginal dry treatment and precautions. The treatment of vaginal dryness is also directed at the cause. If there is a high prolactin hormone, this can be corrected by medication or surgery. In case of estrogen deficiency, as in menopause, local and systemic hormonal drug treatments can be applied like suppositories, rubs or creams containing estrogen. Infections can be treated if it is due to vaginal infections. If there is dyspareunia, its causes should be investigated and appropriate treatment methods should be started. The treatment of vulvar vestibulitis syndrome is surgery. Sexual reluctance and arousal problems should be treated with sexual therapies. Use of vaginal lubricants. Medicinal products that lubricate the vagina during sexual intercourse and thus facilitate penetration are called vaginal lubricants. In cases where there is no reason to cause vaginal dryness, lubricants can be used. These lubricants are marketed in pharmacies as suppositories, creams, gels, sprays or creams in applicators. Non-allergic or irritant, suitable for vaginal pH, with acidic pH, and water-based lubricants are recommended. Vaginal dryness must be treated. Those who have vaginal dryness problems can cause sexuality with pain in sexual intercourse, dyspareunia problem. This can lead to problems in the couple relationship, marital problems and loss of self-confidence. For this reason, women with vaginal dryness should be treated with appropriate treatment methods. What can be done to prevent vaginal dryness? The vagina is an organ with a perfect self-cleaning system. The inside of the vagina should not be washed, and the vulva should only be cleaned with a little water or only a dry tissue. Shower gel, soap, foam and shampoos used during the bath should not be exposed to too much contact with the area. Pads and tampons bleached using chemicals may also disrupt the natural balance of the vagina. Using a menstrual cup or fabric pads are the best options to maintain the natural balance of the genital area. Probiotics should be consumed to feed the beneficial bacteria in the body and to prevent the growth of harmful bacteria. You can take it in capsule form as a supplement, or you can supplement with probiotics by eating healthy fermented foods or yogurt. Natural lubricants such as coconut oil, olive oil, aloe vera gel can be used. Gently massaging the vulva with healthy oils after showering will also be supportive. If any medication you use regularly is likely to cause vaginal dryness, you can discuss with your doctor what you can use as an alternative to this medication. You should be able to openly discuss your discomfort with your sexual partner. Sometimes just being more gentle and patient during sex can solve the problem of vaginal dryness. Remember that everybody is different and your body may experience some changes from time to time. Be gentle with yourself as well. And lastly, please like and subscribe so you can keep learning more knowledge about your health.